All right. Well, good afternoon. This is Dr. Kaminsky. I'm here with Dr. Eric Jauhiainen, our resident COVID expert. Um,
You're too kind.
and just going to do an Omicron update today. Thank you once again, Dr. Jauhiainen, for helping our community have a better understanding of this situation and helping us formulate some solutions. So
Ye-
maybe can you just start off and maybe give us a little review on what we've learned and experienced with Omicron up to this point?
Yeah, this has been a crazy ride. It seems like something's changing every day, and if you're not reading almost daily, you kind of fall behind. It's taken me by surprise too. Um, as people know, Omicron was first detected in South Africa from specimens of people with COVID from early in the month of November, and it was the World Health Organization was notified about it on November 24th, and so they declared it a variant of concern. And what was so alarming about it was how rapidly it was spreading. So in South Africa, just a quick review, Delta variant, they were not having that many COVID cases because it's their summertime. And they had a lot of natural immunity because in some areas, 70% of their population had already been infected. Um, so, in October, overwhelmingly the cases there were Delta. By the end of November, they had um, 80 they had 75% were Omicron, were the new variant. It took over incredibly rapidly. And they were also seeing a bump up in their hospitalizations. They had overall across the country a 60% increase in hospitalizations during November. So the alarm went out. And so people began testing for this variant elsewhere. And pretty much soon it's like, oh, it's in England and it's in Denmark and boom. And how rapidly is going to take over. So they start doing this genetic testing to find out, well, how much of this is Delta? How much of this is the older viruses? And nobody anticipated how rapidly this was going to spread. Let's talk about the US. The first case that was declared in the US was on December 1st, a first documented case. By December 9th, and the CDC put out a map, and it's kind of funny. I sent a copy of this map to Dr. Kaminsky. We were talking about resources to use for the health department. And on the 9th of December, it had this map with 17 states on it. By the 16th, it had 36 states. And as of a couple of days ago, it was 47 states. And the reality is that every state has it, guaranteed. It's not even close. The first case in Washington State was, I believe, the 4th
I believe so.
of December. Yeah. And, within a week and a half or so, it was 40% of all of our cases. Now, the CDC just came out with an announcement yesterday that the Omicron variant represents about 73% of all the cases in the United States. So over the course of, less than 3 weeks, it has just taken over, which means it spreads way more rapidly than Delta and has taken over. So that brings up a whole bunch of other issues, Dr. Kaminsky.
Yeah, what are your concerns about that rapid escalation in case rate?
Yeah. Well, it's kind of funny. I have to confess that I was totally wrong about how rapidly it was going to take over. I said it, less than 2 weeks ago that I thought it was going to take quite a few weeks in the US because, we've got such a high vaccination rate. Well, it turns out, no, it has taken over way more rapidly than that. My concerns about it are that, in part, even if it raises the issue of, is Omicron more likely to be less severe? And the initial stuff that came out from South Africa said, their largest healthcare organization said, well, they had about a 30% drop in hospitalizations with Omicron infections compared to the earlier Delta infections. So that looked positive. And South African doctors were saying, yeah, I'm seeing these people with Omicron, but they're not as sick, and they got headaches, and they got some different symptoms. And, so people have kind of sometimes this information has gotten out that it's not serious. Well, look at it. If your case rates increase dramatically because it's so contagious, a 30% drop in hospitalization still means that you're going to have a net increase. Let's say you're in a big city, you go from 1,000 cases a day and 10 of those people are hospitalized, 1% hospitalization rate. Now you go to 2,000 cases a day. Well, maybe you're going to have, even if it's 70% or 30% less contagious, now you're going to go up to 14 cases a day that are in the hospital or more. So I'm worried that we're going to totally overwhelm our ability to care for people in the hospital settings, and people are going to get, they're so tired about, wearing masks, and I'm afraid we're going to get overwhelmed because this is incredibly contagious. People are comparing it to measles.
Mm-hmm. We were talking earlier, and you were mentioning, even if you've had the past infection, even if you've been vaccinated in the past, but if it's been remote from today, looking at your immune system and that rapidity of how things rise,
right,
getting prepared
yeah,
for this rapid rise.
right.
I mean, we potentially missed the boat a little bit as a community.
There are a couple of major parts of your immune system. One is the antibodies that your body creates, like when you're vaccinated or when you get a natural infection. The other parts are what's called the cell-mediated immunity, where you have cells that are called natural killer cells that can go in and grab a cell that's infected. And so the primary function of the vaccinations is to increase your antibody levels, which is kind of your rapid response to what is part of your rapid response. And the thing is, with the earlier infection, let's say you had, people think, oh, I'm protected because I had already had COVID, I can't get serious illness. So that was true for the very earliest variants, what's called the wild type or the alpha or beta. There was a study just published last month. It was a letter in the New England Journal that showed that in the Kingdom of Qatar, they had a subsequent infection after initial infection, that the serious illness dropped 90%. But then you look at the date, and so this is being widely broadcast on you'll find all kinds of stuff about it. But the problem is that data was from early in the year, and it didn't represent Delta, and it didn't represent Omicron. And what they're finding is people who have had a prior infection or who have remotely been vaccinated, let's say they were vaccinated 6 months ago, they have almost no active antibodies to fight Omicron. So, that's the problem and they're in England, which has been hit really hard with Omicron, is seeing a lot of breakthrough infections. They have a very highly vaccinated population, and they're seeing a ton of people get infections even after 6 months out, 7 months out from vaccination or from infection. They're getting breakthrough infections. So that raises the whole issue of, how do we prevent breakthrough infections? Boosters. Yeah.
And it's not to say that those old vaccines, the original series, didn't work.
Right.
Your first line of defense, those antibodies diminish over time. That happens
Right.
with a lot of conditions and a lot of vaccines.
Right.
And your body does have you mentioned that cell-mediated immunity. Your body has some memory. It can
absolutely
remake antibodies if it gets re-exposed, but there's a lag time there.
Yeah.
And so there's something. Tell us what's unique about Omicron, that because of that lag time when you're trying to make new antibodies.
Yeah. So what's been done about that is they found that, with, say, the Delta variant, the number of neutralizing antibodies kind of stayed pretty high for several months and then started to lag. And that's why in Israel, which had a very, very highly vaccinated population, they got about 5 months out from the vaccination, and they noticed that, man, we're starting to see breakthrough infections in vaccinated people. So they started ramping up their booster system on July 30th. And they started with the older population. They dropped it down to age 12 in July and August. And it's that booster which ramps up those antibodies very rapidly. And what they found in Israel when they did boosters, so they had over 4.5 million people to compare, all vaccinated. And about half of them boosted and half not boosted. And what happened with the boosters? Well, in that population, and this is related, this is mostly Delta at that point, they found that the people who didn't have boosters had 10 times more documented infections, 18 times more serious infections. And the older population, that's 16 older, that's me, they had about 18 times more deaths than the boosted. So it was clear that these boosters work because they ramp up those antibodies and give you the give you something to fight a new infection. And the problem with Omicron is that instead of the antibodies being active for several months and then dropping down, what they do in using serum from old patients is the antibodies drop down much more rapidly. And so prior vaccination 6-8 months ago doesn't really protect you much from getting an acute infection, but boosters raise antibody levels up very rapidly. Now, how long? We don't know.
Mm-hmm.
Hopefully for a long time. But again, it's not that unusual for vaccinations to require multiple boosters. It's the hepatitis B vaccination is one vaccination, another one a month later, another one 6 months later, and that lasts for a long time. So we don't know with this.
Mm-hmm. You were mentioning earlier just some of the dynamics of the Omicron virus itself. Just, you talked about the transmissibility and how rapidly it multiplies and how it sheds much more vigorously.
Yeah. So, I mean, it's the mysterious thing is, why is this virus so much more contagious and spread so much more rapidly than even the Delta variant? And so how can a virus be, these are the coronavirus, but this is a different animal. And they're trying to figure out why it spreads so rapidly. But you can think of a couple of things. Number one, it might not take as many viruses to make you sick. So let's say you go to Safeway or drugstore or restaurant or something, and you wear a mask or something, and you inhale 200 viruses. A few of those then get into your airway. How many of them does it take to make you sick? It could be that if only a couple of them enter your cells, that's not enough to make you sick. And that's one of the reasons masks work, is they decrease the amount of virus that you're going to inhale. So it might not be enough to make you sick. So how could a virus cause more illness with a lower number? Well, the virus might bind to the receptor much more strongly. The second thing is it might multiply much more rapidly inside the cells. And that's some of the earliest studies that looked at the large airways. So large airways, trachea, mainstem bronchus, and the larger airways. And a study that was done in Hong Kong showed that the Omicron variant multiplied in the large airways 70 times as rapidly as Delta. So that's one of the reasons it can be so contagious. It comes in, it invades the cells, and then it just multiplies much more rapidly, which is another reason for having antibodies and good boosters so it doesn't get a chance to invade. Now, the positive part about that in the studies of lung tissue, it didn't spread more rapidly. So maybe it means that Omicron infections are going to be a little less serious, but it's just not known. The other thing that can happen is, how can a virus be much more contagious? Is a sick person might shed more of the virus into the air. So, instead of coughing out and having a million viruses go into the air, maybe it's 5 million. And you think those numbers are high? That's actually not that unusual for a person to be spewing out, hundreds of thousands or millions of viruses. It's just not unusual. So anyway, those are some issues about Omicron that, it seems to really spread rapidly in large airways.
So getting your antibodies primed and having your soldiers ready on the front line, then if you do get exposed, you're much more protected, as opposed to waiting when your antibody levels are lower and waiting for your body to get some memory and start making their own antibodies.
Right. And that is a great analogy, Dr. K. Because, you want that. You get invaded whenever you get invaded by a virus or a bacteria, whether it's a common cold or flu or whatever, your body's immune system sets up to fight the virus, right?
Mhm.
And you want to have a strong army ready to go rather than have to try to recruit it. When you get invaded by a virus, it takes your own body like a week or two to start creating antibodies. And now you have other cells that will kind of attack the virus and control it. And if it's a virus your body has seen before, usually you can handle it without any trouble. Um, but you want those antibodies ready to go, and that's the reason for the booster. Is
Mhm.
Rather than try to go recruit an army, when you're attacked, you want to have it ready ahead of time. And
Right.
that's a good analogy.
Yeah. Some people, have the strategy not getting vaccinated or not getting boosted, and potentially using other medical therapies like the monoclonal antibodies. Why is that a bad strategy?
Okay. The reason it's a bad strategy with the monoclonal antibodies, which is what we have available now. Let's say a family member gets COVID and you've been living in the same house and you're really worried about getting seriously ill. And, maybe it's been a long time since you got vaccinated. You can go get an injection of monoclonal antibodies and it decreases your likelihood of being hospitalized dramatically. But it doesn't work with Omicron because the monoclonal antibodies were designed for the prior spike proteins and the binding areas on those proteins. And there have been so many mutations on Omicron that monoclonal antibodies are not going to be effective. So that is not a good strategy for avoiding a booster. So I'll just go get antibodies. That's not going to, it's too late for that.
Yeah. I hear they are going to attempt to develop some new antibodies, monoclonal antibodies, but
You know,
who knows when that's going to happen? And what about
and
the
it,
other antiviral treatments? What about those?
well, this week, the FDA is probably going to rule on an antiviral pill from Pfizer and another one from Merck. And the Pfizer pill in particular, shows a ton of promise. It's called Paxlovid, and it decreased hospitalizations in people who were at fairly high risk for hospitalization. So they chose a population, old people like me or people with chronic medical conditions. They chose a higher risk population, and when they got early COVID, they gave them this antiviral pill, and it decreased their rate of being hospitalized 89%. So really startlingly good, and it looks promising, but it hasn't received FDA approval yet. Probably will this week. And I'm sure they're going to manufacture like crazy, but it is not at your local Safeway or your local CVS yet.
Yeah.
Hopefully it will be. But Omicron is spreading so rapidly. Don't count on getting your Pfizer pill if you get sick right now. We just get your booster.
All right. Well, what do you see? What do you envision the numbers for Washington State? What kind of time frame are we looking at? I know it's hard to predict everything, but
This is just so crazy because what's so weird is this Omicron took over so rapidly in Washington State. I mean, it's clearly in the majority, right? It took so rapidly in the country, but Washington State numbers, you know more about that than I do. What about the counties over on the east side? They're pretty highly vaccinated counties. What's happening to their case rates over there? I mean,
the majority of the counties, the case rates are going down. A lot of the eastern Washington counties are going down, but the looks like in King County, Snohomish County, some of the counties that had some of the first cases of Omicron, they're on the upswing.
yeah,
And different parts of the country change at different times, and we were just coming down off this Delta wave, and actually some of the little peaks we've had over the past several weeks have been Delta peaks, not
yes,
Omicron.
right.
And so we're still dealing with Delta, but just with its doubling time, 2 to 3 days. I mean, it could potentially be a torrent.
I mean, it could be, it's just too early to tell. And we can all hope and pray that that infections from Omicron turn out not to be as serious, but there's no clear evidence of that yet. It is way too early to tell. And the initial large study out of England said, we can't say that.
Mm-hmm.
So and in South Africa, where they had a high rate of prior infections, their hospitalizations went up very substantially. So it's you're going to be exposed to Omicron at some point. You just guarantee it. Somewhere, even if you're very careful, you're going to be exposed to it. And, it's just too contagious. And you just be protected, be safe, wear your mask, get your
around the
boosters.
holidays. Yeah. But and also, especially with the holidays, incorporating a testing strategy. There's the Say Yes free testing kits you can get from the government, from the federal government. You can get stuff over the counter. We have our Southgate testing center. So it would be reasonable to test, several days before you're going to head to see grandma, and maybe test the morning of as well.
That is a great company. And so we're having, Christmas with family here, and we've got at least one person coming in from out of town, and haven't had their booster. So we're making them test for a couple of days before joining us.
Yeah.
I told my son, who's heading out of town somewhere, I said, go to the store, get your testers, because you're going to be with some older people, even if they're vaccinated. Test yourself after being on the plane, test 2-3 days in a row. Usually it takes about 3 days for people to become positive on the test, 3 to 4 days after exposure. So if you're on a plane, test yourself 3, 4, 5 days later. And the federal government has announced that they're buying 1 billion test kits to be available for people free of charge. So,
well, anything else to add?
No, I think we've covered it, and it's a changing scenario. It's different than I thought it was going to be when we talked last almost 2 weeks ago. I mean, it's just amazing. And Dr. Kaminsky, thank you for your work for this county and trying to keep us all safe.
Thank you. I just had my year anniversary a week ago today. So it's been quite a ride.
All right.
But thank you for your expertise and for keeping our community up to date. Really appreciate you. Thank you.
Thank you.
And happy holidays.
Happy holidays.